Hi everyone, thanks for viewing my presentation on my paper in progress titled Food Banks and COVID-19, a comparative policy study of Canada, the UK, and the US. I'll first review the prevalence of food banks in each country and how COVID-19 has impacted food banks. Then we'll go over the theory that underpins the paper, looking at the policy process, and why food banks may have been part of the COVID-19 response. I look at this process using comparative case studies. We can identify a similar process. So by studying the process comparatively, we're able to model the process in a way that can be used outside of specific country context. Following that, I'll give a brief summary of how food banks have been part of each nation's COVID-19 response. And to conclude, I'll give some preliminary insights about what this means for food banks and where this leaves us in the policy cycle. So the first thing we need to talk about is, why is this important? Why talk about food banks? Over the three countries we're discussing, we know food banks have become a part of the social welfare fabric. From what we can tell, the first food banks were introduced in the US in 1967, in Canada in 1981, and in the UK in 2000. Since then, food banks have expanded across the nations and have become embedded within their systems. The three major food bank networks, Food Banks Canada, the Trussell Trust in the UK, and Feeding America, have all become major networks and organizations, corporatizing food banks beyond just the local church-run operation we tend to think of. You can see on the screen the sheer number of affiliated food banks and food pantries. The Trussell Trust gave out 1.6 million three-day emergency food parcels in 2018 to 2019, which is a 73% rise from 5 years prior. In March 2018 alone, there were over 1 million visits to Food Banks Canada affiliated food banks. And alarmingly, Feeding America states they reach 1 in 7 Americans and delivered 4.3 billion meals last year. It's also good to note that these are not the only three organizations, and they're not the only food banks in these countries. In Canada, for example, there's an estimated 250 food banks operating independently. We focus here on the three main organizations as their formalized, powerful networks. So we know there are a lot of food banks, but how does this relate to COVID? And why should we care? Let's start with the US. Previous research has shown that insufficient income is the overarching cause of food insecurity. And in a crisis which has left 30 million Americans unemployed at one point, it's not surprising people need more support. One of the biggest food banks in the US is San Antonio Food Bank. Prior to COVID, they supported 58,000 people per week, a staggering number in its own right. In April 2020, the food bank served 400,000 people. In March, Feeding America food banks gave out an average 20% more food than usual, and the group estimates that as a result of COVID, 1 in 6 Americans could face hunger. On the left, we have an image of a food bank warehouse set up in a South London church, helping 3 food banks meet the heightened demand for food in the area. The 3 food banks, Brixton, Norwood, and Waterloo, saw a 135% increase in people supported compared to April last year. More generally, the Trussell Trust saw an average increase of 81% across the network in the last 2 weeks of March, including a 122% increase in the number of parcels going to children. In Canada, food banks are also stretched to capacity. Food Banks Canada saw an average increase of 20% during COVID-19 and expect the demand to keep increasing. The increase in demand comes at a time where it's reported 1/3 of food banks closed due to the pandemic. Importantly, Food Banks Canada has acknowledged the long-term impacts of the 2008 financial crisis and is applying those lessons to this pandemic. They report that the network experienced a 28% rise in usage after the financial crash, and that demand never really went away. They fear the same thing will happen again here. The demand will rise, food banks expand capacity, and the root causes of why people need food banks aren't resolved. On the screen, we see a thoughtful insight from the co-director of the London Food Bank in Canada on the evolution of food banks due to the crisis. This leads well into the theory that underpins this comparative case study. In their book, Kramer and colleagues discuss how the oil crisis in the 1970s led to a crisis of the welfare state in some European countries and in North America. They essentially argue this crisis created an opening for charities to fill the gaps and correct the issues many felt regarding the welfare state at the time. They note how the crisis led to three trends, which are listed on the screen. One, the rapid increase in the number of charitable and voluntary organizations. Two, the ideological adoption of privatization and that the charity sector should be used as a government tool and viewed as an economic provider of public services. And three, the institutional changes that were described as modernization. I argue we can apply these lessons to the evolution of food banks, specifically within the three nations at hand, and it can show how food banks have become a policy option in a time of crisis. Here we can see my theorized policy process explaining the pattern of how food banks evolved in the three countries. The process outlined gives us a context to discuss the three countries comparatively, as we know they followed this similar trajectory, although at different paces and to differing degrees. I'll touch on each of these steps, but let's focus on the top row first. The basic overview is that food banks are introduced into the charitable system and they become more widespread around the time of a crisis, such as the 1970s oil crisis or the 2008 financial crash. Essentially, we see a crisis act as a policy window for expansion. Kramer and colleagues' argument fits really well here and provides a basis for how the charitable section is introduced into the welfare system. We then see governments start to, or continue to, fund food banks in order to help support the social welfare system. By contributing funds, whether at the local authority level or nationally, it both acknowledges food banks at least as a partial solution towards food insecurity, while offloading at least part of the resolve or responsibility onto the charitable sector. Food insecurity researchers Riches and Tarasuk looked at this shift in responsibility in Canada and found that the social construction of hunger as a matter for charity led to the depoliticalization of food insecurity as a responsibility of the state. By government entities funding food banks, rather than creating bespoke policy that addresses the problem themselves, we see the food banks gain traction and power within the policy cycle. With the help of government funding and the lack of sufficient public policy solutions to food insecurity, food bank networks fill the gap. By this stage, you may have lots of independent food banks, but it's the rise of food bank networks that really integrates food banks into the policy process. When food banks form under a network, such as Feeding America, we see them become large corporatized organizations that embed within the system, linking with businesses, charities, and generally within the welfare safety net. They become so entangled in our approach to food insecurity that they become institutionalized and too big to fail. And by this, I mean, if one of the major networks closed, the social safety net and other aspects of society would be majorly impacted. Richards talks about this specifically in a Canadian context in 2002, but we can apply the same idea to the US and the UK as well. As food banks become widespread, they are normalized as part of the social safety net. Here's where the movement in the shared political responsibility between governments and food banks becomes ingrained. A good example of this is how UK job centres used to refer people to food banks, which is really tying food bank systems to the welfare response directly. Although there may be dissent and critique of the food bank system, they are viewed as a necessity. Public policy on its own would not be able to immediately cope without them. We can see the links here to what Kramer and colleagues' points were about the widespread belief of charity being a provider of public services. The degree to which they are entrenched in the systems and accepted by the public and governments really varies depending on things like political context, the type of welfare state, and the religious histories of charities in the nations. But the idea that food banks are a policy option leads to what we see with COVID-19. I'll now very briefly review the COVID-19 food bank-centric national policies of each country. So in response to COVID-19, the US Department of Agriculture launched the Farmers to Families Food Box Program, which funded US farmers and food suppliers to redirect their products to food banks and other groups. You can see a breakdown of the program on the slide. The program launched in April, contracting out $1.2 billion in food products within the month. As of June 23rd, over 20 million boxes of food have been distributed. The program has been authorized to spend $3 billion, so it's likely we'll see additional funding rounds this year. Additionally, through coronavirus legislation, food banks will receive $850 million in USDA procured food and funding towards administrative costs. While we saw the US take an economic, agriculture-based response, the UK has framed their food bank funding as a charitable initiative. As part of the government's announced £750 million fund for frontline charities, $16 million will be allocated to food-based charities. Instead of funding food providers and farmers themselves, the UK will run the program through FairShare, a food redistribution charity, and WASP, who consults on food waste. The government says this is the best way forward, as the two groups already have well-established networks with food banks, including those in the Trussell Trust, and charities to allocate funds in meals to local groups, which will simplify the logistics. The government has also created the Food Charities Grant Fund, where food banks and food charities can directly apply to DEFRA for up to £100,000 to alleviate issues in meeting demand with COVID-19. You can see the requirements here on the screen. An interesting note is that being within the FairShare network is a requirement of the grant funding. The Scottish government in June also announced £1.6 million in funding directly to go to FairShare to continue their work in Scotland. Canada has a more straightforward program. On April 3rd, the Prime Minister's office announced $100 million to be invested in food banks and local food organizations, with 50% of the funding going directly to Food Banks Canada. In all the countries, you'll find some local authorities, provinces, and state fundings of food banks, but this paper focuses on the national level approaches for a more straightforward comparison. So we know Canada, the UK, and the US are all using food banks as part of their COVID relief strategies. Based on our theory of the policy process, we can predict this crisis will have an impact on the way food banks are engaged in the welfare system. I argue this crisis could be the cementing factor of food banks within society. You'll hear food bank organizations like Food Banks Canada state their mission is to not exist. Yet we see the integration of food banks into the government crisis response. There is real potential that in all three countries, food banks will hit the point of no return, that they have become too entrenched in the system to be removed. Thinking of the policy process, this has furthered all three countries into a form of path dependency. To use a phrase from Pearson, the stickiness of food bank institutions will be harder to remove now that the governments have utilized them in the COVID-19 response. What's the takeaway? If governments continue to fund food banks instead of sufficiently addressing the root causes of food insecurity, in the present and in future pandemics, we'll find food banks becoming further and further embedded in the welfare state and in public policy more generally. Thanks so much.